This model demonstrates the muscles that aid in the flexion and extension of the olecranon hinge joint. The first muscle we'll be talking about is the bicep brachii, which is located on the anterior humerus. And the bicep brachii is on the coracoid process, and its insertion is on the radial tuberosity, and it flexes the elbow and also supinates the forearm. The next muscle we'll be talking about is on the posterior side here in the green, and it's called the tricep brachii, and it's on the infraglenoid tubercle of the scapula, and it's on the posterior humerus, and it inserts on the olecranon process of the ulna, and when it contracts, its action extends the forearm. In between the bicep brachii and the tricep brachii is the brachialis here in orange, and it's on the distal anterior humerus, and its insertion is the coronoid process of the ulna, and its action is to flex the forearm. The next muscle we'll be talking about is the brachioradialis here in purple, and it is on the lateral head of the humerus, and its insertion is on the styloid process of the radius, and when this muscle contracts, the forearm flexes. The last muscle we'll be talking about is the pronator teres here in white, and it extends from the head of the humerus across the elbow down onto the ulna, and it allows pronation of the forearm. The musculocutaneous nerve enters through the coracobrachialis, not shown on my model, enters through the coracobrachialis and exits through the bicep brachialis, shown here in the teal. Lateral epicondylitis is inflammation of the brachioradialis here in purple, and it's due to the overuse of the tendons of the forearm that attach at the epicondyle. This usually occurs in manual labor workers or athletes that twist and extend the wrist against resistance. The treatment is ice, elbow pads, reduced activity, physical therapy, injections such as steroids, and surgery as a last resort. On the anterior side, just below the bicep brachii, we have the MCL anterior bundle, and this bundle is to keep the ulna from going past 180 degrees. Posterior to that, we have the MCL posterior bundle, and this bundle is to keep the ulna in place with the humerus. Next to the MCL anterior bundle, we have the annular ligament, which keeps the radius and ulna tightly packed close together. On the medial side, we have the medial collateral ligament, which is shown right here. This ligament is just there to keep the humerus and ulna from bending medially. And on the lateral side, we have the lateral collateral ligament, which keeps the elbow from bending laterally.